Wife left her job to take care of me during the whole cancer saga, which happened earlier this year. Yeah.
Okay.
So
And what happened with that?
what happened? Okay, so uh yeah, I'll just give you the highlights. So
You go into it a little bit. I want to spend a few minutes to get to know
uh,
you.
okay, thanks, Jonah. Okay, so I was at a friend's place. Suddenly my left eye went out. It used to be open. Recently there is some problem. So one of the vision went off. So I went down to the. Oops, sorry. Yeah, that was my reminder to join the call.
Yeah.
Yeah, so I went to the hospital thinking it's an eye problem, but suddenly they realize it's a blood problem, leukemia. So it's like a white blood cell cancer. So they found that the number was like about 15 times more than the normal range. So basically, when the white blood cell gets a lot of like the cancer cells are unlike the tumor-based kind which latch on and grow. The white blood cell is like a abnormal cell, so it kind of like clogs up the blood. So my blood became
Hmm.
like gluey, glue-like substance. So when the blood is not really flowing, it kind of clogged up certain places. So the eye was one of the places they clog up. And basically, people saying there's pretty much nothing they can do, and that's it. So I was concerned about, oh no, it's my eye, I'm gonna lose the vision, but I'll manage. But the scary thing is that they were suspecting leukemia. I'm thinking, oh my God, another issue here. So I was
Wow.
thinking, like,
So did you lose the vision or
yeah, it's gone
wow.
pretty much.
Wow.
Yeah,
Did
so
they
it
like take out the eye to get rid of the cancer or like what happened?
no, so it's basically it's clogged up, so they did like a pretty strong chemotherapy. So the cancer I had was so there are basically two types of acute leukemia, two to three types mainly. So
Hmm.
I had a mixture of both. So it makes it harder to treat. So
Okay.
when you Google it, the prognosis is absolutely terrifying. And anyway, they did a very strong chemo, 10 times the dosage. So they managed to get it, which I'm very thankful for.
Wow. Or else it could have spread all over the place, right? Like that's how
Yeah,
these
no,
things work.
yeah, exactly. So yeah, so after that one round, so it was a month, and I get to go home for a week, and I go back for another month. So about the 10 times chemo dosage, did it for 2 months. Then after that was on maintenance chemo for a while. Then the goal is to do a bone marrow transplant, which I was a little bit apprehensive about it because straight off the bat, bone marrow transplant has about 25% mortality rate. That's just a given. So not so keen, say, and they couldn't find a perfect match. So
Um, my system is really like supporting you. Like I feel all
oh,
this
okay.
energy starting to come through and it's starting to build. So it's like I really want to help. I did get that it will take more than one session.
No worries. I
Because I
totally get
think
it.
but that's okay. Like you can go ahead and um I'd say like a couple weeks time I'll be kind of back on the 6th. So and like 6th, 7th, 8th, that time like we can continue because we have a
That
little
that
bit
that,
of
that
things to work on here.
yeah, yeah, sure,
Yeah,
no problem.
just a little bit.
Yeah,
So let's get started in a second. And the other thing is sometimes I do go over, like if I get the message that kind of a lot needs to be done, sometimes I'll go over, but I have another session right after this, which usually
no
I
worries.
don't. Like I try to leave a little gap, but I do. So we will have to end, I guess, in 54 minutes.
No
So
worries. Yeah.
let me um let me set a timer here. We'll do some closed eye work. And what I like to do is for us to, get into a state of focus where we're in touch with our body, we're in touch with how we feel, we're in touch with the emotions.
Cool.
And let anything that needs to come out come out. There are a lot of reasons why disease is caused, and it might not really, like, so to speak, be your fault. It might not even be things you're aware of. Oftentimes, it's It could be a childhood trauma and things have just kind of gotten stuck. It could be something in the past life. This is old stuff. It's stuff we don't, need to deal with anymore, but we need to let it come to the surface and let it come out. And a lot of what I do, what my system does is get to the root of those issues and add a little bit of grease, add a little bit of lubricant to let things come out, let things come out a little bit faster. So we'll take this time to meditate. I'll leave a few minutes at the end for us to kind of talk and debrief a bit. So I'll set for 40 minutes now. Um, and it will basically be quiet, for that time period. So you won't hear much. I'll probably even put it on mute in case there's some noise to disturbance, so like both of us can kind of remain in that focus.
All right.
Um, so let's get started. I'm gonna grab one other blanket. I'm looking, it's like the German winter, and it's
Oh, okay.
it's probably like a little bit colder than you are there. Um, so give me like why don't we start? I'll be back in like 20 seconds
No
and
worries.
we'll just keep going. So you can kind of just close your eyes, relax,
Okay.
and then I'll be tuning in with you and we'll be tuning in with each other.
Cool.
Okay. So yeah, when it went a bit over. Let's see what was going on with this timer. I see. Okay. All right. It wasn't really ringing. Um, so yeah, how was it for you?
Oh, I don't really know how to describe it. I did felt quite a number of sensations around my body, like
Hmm.
stuff bubbling up. I don't know, like some sensations going up from my toes up to my head. Sometimes I feel a tugging feeling. I'm not really sure. Yeah, but I do feel something shifting inside.
Hmm. Okay.
Is that
All right.
normal? I don't know.
I think everybody feels different things at different
Uh,
times and the process can shift. Um, in what parts of your body were you feeling things?
to be honest, I felt the upper torso area, something was being pulled out. Then
Hmm.
that was for like a few minutes. Then after that, the back of my head felt like
Uh-huh.
there are a few rubber bands and something is tugging it, pulling it. Yeah, and I had a strange cough, like I don't know, just came out of nowhere. Yeah.
A cough came out of nowhere, yeah. Yeah, I
Mm.
felt a lot going on the left side back of the head, especially in the
Um,
earlier part. I don't know if you felt that. I thought that was pretty unusual.
that makes sense. There's a lot of stuff going on recently on the left side of the head. Uh, this eye right there is shut. It wasn't shut until recently, a few weeks ago. 2 weeks ago, I was hospitalized because the left eye there is a ptosis, which is basically a droopy eyelid.
Mhm.
As you can see, like it's not as big as the other eye. So they were worried like there is some brain involvement. So they did a lot of tests, a brain MRI, CT, and angiogram. So they found like there's nothing major, but basically there are two cranial nerves that are not really functioning that well. So yeah, the left side of
Mhm.
the brain, yeah, I'm sure. Yeah, there is something going on there. Yeah.
Okay. Okay. Yeah, that makes sense. Yeah, I felt a lot of time there. And then after that, I felt it move kind of to the center area, kind of like center of the forehead. Did you feel things
Oh,
there as well?
not too sure. There were a lot of like concurrent feelings.
Fair enough. Fair enough. Yeah, I did feel a lot going
Yeah.
on in the chest here.